Hi, Facebook. We're going live here. Let's just give some moments for Instagram to join us. Hi, Instagram. Glad you could join us. We are going live here. We're back for another Let's Talk. It's Tuesday night, 8:30, our regular time, so we can find out a little bit more. This is Dr. Sabine Elisee, board-certified family medicine physician. I am the CEO and co-founder of Cornerstone Medical Group Incorporated. I take simple, concrete information. I put it together and help you understand it so you know exactly what's going on in your body so that you can identify two things. One, how to be more productive in your life, and two, how it's affecting your overall well-being. Well, and how do I do this? So I do this through my medical expertise and my restorative approach to patient care that focuses on the entire body to reconnect your physical, spiritual, and mental components of your health to enhance quality of life. All right, so we're going to get right into our teaching. So excited again to be back with you. So let's do a little bit of housekeeping as usual. Hi, Nixie, thanks you for joining. Hi, Dr. Duquel, nice seeing you. Let's talk for another episode. I like that. So just go ahead and say hi, Facebook, as you come in as well too. Again, just a little bit of housekeeping like we do. When I'm looking here, it is because I am speaking to my Facebook folks, not to ignore when I'm looking here, because I want to, of course, address my Instagram folks as well too. So I'm going to do my best, like always, to make sure that we're engaging both of these videos tonight. So once again, those of you who are coming on in, hi to I_NEP. I'm glad you joined in for another Let's Talk. What are we talking about tonight? We are talking about the sun. We are talking about the sun, the damage it does, the benefits as well too. And I really do want to answer some of the questions that I even receive in office. And one of the biggest questions I receive from Black people, from white people, from grandparents, and even parents who are with their biracial children. So the grandparents will have their biracial children over the summer. So I've been getting that question a lot. And that big question is do Black people need sunscreen when they go outside? The question that I get a lot of times, sunscreen, do Black people need sunscreen? Yes, that's a resounding yes, we need sunscreen. So our skin is all the same, right? It's the exact same skin. I have the exact same skin as my sister-in-law, Steph. Hey, Steph. Exact same skin. The only difference is that I have more melanin in my skin, and she has melanin in her skin too. So I have a little bit more. So what do we need? We need sunscreen. We need sunscreen that is at least SPF 15. Those of you who are in the chat, go ahead and put 15. And I say these numbers specifically because I want you to remember them when you are going out. There's like key things that I'm saying. Remember, this is all about me providing simple, concrete understanding to what's going on in your body so that you will be well informed and know what's going on. So 15, it has to be SPF 15, my skin, your skin, my sister-in-law's skin, so it doesn't matter if you're Black, white, you know, you just need SPF 15. The label should also say broad spectrum. Those are key words, broad spectrum, UVA, UVB. That's the big thing. We need that sunscreen. We need that sunscreen. But you know that already, right? You know that already. So that is the portion that you do know. What I do want to talk to you about are some of the things that you may not know, things that are important for us when it comes to the sun, how it helps us, how it hurts us, and what we can do to prevent it from hurting us. So one of the first things I want to ask is, how many of you know a benefit to the sun? Why it is important for us to sit out here in this heat for a little bit to get some sun in our skin? Go ahead and put in the comment line if you think you know what it is. Why do we need the sun? What does it give us? Can I give you a little hint? You guys want a little hint? It gives us a vitamin. Which vitamin? All right, let's go ahead and hit D. Vitamin D. All right, see, Nixie, that's right, vitamin D. D as in dynamite, all right? Vitamin D. It's very important that we have vitamin D in our bodies, okay? So we're even checking vitamin D even in pediatric patients. And I'll tell you this, that when I was in medical school, that wasn't really pushed as as much as it pushed right now to get that vitamin D, get that lab, understand why we have it, why it's important. So let's talk about why the vitamin D is important and how it affects us. So first of all, vitamin D penetrates our skin, and once it gets into our skin, the sun penetrates our skin, excuse me, and once the sun gets into our skin, that's how we absorb the vitamin D. There is a reality that if you have more melanin in your skin, then the sun doesn't penetrate as well to give you the vitamin D. So in other words, more melanin, if you're black, if you're darker, more chocolate, then your vitamin D the sun isn't penetrating your skin as much to get that vitamin D. And then on top of it, I just told you to put on sunscreen, at least SPF what? 15? That's right, SPF 15. So that's another reason why that vitamin D, that sun isn't able to penetrate our skin all the time to get us the vitamin D. So it's not uncommon that if you go to your doctor's office and they check your vitamin D level, for you to be vitamin D insufficiency or deficiency. Insufficiency or deficiency. So insufficiency is just telling you it's a little bit lower than what it should be, and the deficiency means that, okay, it's really low. So in which case your physician will more than likely be giving you a supplement. So don't be so thrown off if you notice that your vitamin D is insufficient or deficient, because here in Florida as well too, we don't get all the vitamin D that we need. All right, so why is vitamin D important? Studies are showing us that for some reason, those individuals who have adequate levels of vitamin D, those individuals who have adequate levels of vitamin D are higher than what it should be. They have a better ability to fight colds. They have a better ability to avoid the flu. So essentially, we are noticing a link with the elevated levels of vitamin D, or the higher vitamin D that you have. It actually increases your pulmonary health. So that's very important. We want increased pulmonary health. So when I say vitamin D, I want you to type in lungs, all right, into the chat. Vitamin D, lungs. That's what we want to do. We were increasing our pulmonary health, and that's why vitamin D is important. It also noticed, and I've seen this just in practice as well too, those individuals that I have who have been vitamin D deficient or insufficient, I start their replacement. All of them say the same thing. They'll say to me, you know, Dr. Elisee, since I've started taking this vitamin D supplement, I find that I have a lot more energy. Find that a lot more energy. So there's so many different benefits to vitamin D. We know that it's increasing our pulmonary health, and we also know that it is also helping us with some energy as well too. So that's why that vitamin D is important. I want to give you that understanding of if that level is low. I don't want you to freak out. So it is very common that is low, and now you understand why that is low in so many people. So we spoke about so far our SPF 15. We've spoken about our vitamin D, and that's one of our benefits to the sun and why we need that sun. Now the third thing I want to speak about is a pterygium. A pterygium, that's right, a pterygium. I put it in one of the feeds this morning on how many of you know what a pterygium is. So if you have ever heard that word before, then I just wanted you to hit Y in the comment box. Pterygium. It's actually spelled with a P, pterygium. If you've ever heard that word before, just go ahead and hit Y in the comment box, and that'll indicate yes. And if you haven't ever heard that word before, then just go ahead and hit an N, a no in that comment box, because then it means no. So what exactly is a pterygium? Excuse me, a pterygium. So a pterygium, you've probably noticed it on people before. When you actually look at the white of their eye, their sclera, they may have what looks like a little bit growth in the corner of the cornea that is beginning to grow. All right, so that's a pterygium. That's what if you go to your ophthalmologist and they see that, they'll make mention that, or put it in their note at least, that you have a pterygium. This is one of the things I even look at for my patients that come in office, because this is all a part of what I was saying, that I treat the entire body. It's very important to look at that. So where does that come from, and how do we prevent it? It is shown that actually that pterygium, that overgrowth that begins to grow from the corner of the white of your eye and goes into the actual black pupil of your eye, that actually occurs from chronic sun exposure, chronic UVA or UVB. So you'll notice in our Let's Talk post today, I mentioned sun's out, sunglasses on. This is the reason why you should have sunglasses on, because of that chronic exposure to the UVA, UVB. It can cause that growth of a pterygium into your eye. And the more that that goes on, it kind of just expands out into the eye. And then that's at the point where it does affect your sight as well too. And then of course, that's when I'll send you to our trusted ophthalmologist, maybe Dr. Diva. Hi, how are you? So that's one of the things that I would send you over, because when it starts affecting your eye and your sight, then this is where it becomes a problem. This is where we have to start speaking about surgery. So how do we prevent it, right? So I'm a primary care physician. I talk about prevention. Simple. Just put on sunglasses. Just put on sunglasses. Again, it goes back to getting those rays out of your eyes, getting the rays off of your skin. And if you didn't know this, it's very important to know that if you are sitting on the sand, if you are sitting at the beach, like in front of a pool of water, or even sitting at the lake, or even in snow, the reflection of the sun on any one of those surfaces actually increases the UVA, UVB that you're exposed to. So I want you to keep that in mind too, the necessity for that sunscreen, the necessity to put on those sunglasses to prevent the growth of a pterygium in your eye. And it's even important to do that for your elderly parents or your elderly friends, and even the younger children. They have so many different things in place now so that we could avoid that chronic exposure of UVA and UVB to our eyes and to our skin. All right, so that's our biggest things tonight. We're talking about vitamin D. We are talking about pterygiums. We are talking about the necessity for the sunscreen. Yes, even in Black people, my people, we need our sunscreen. I don't know how many times I go to the beach and I'm with friends, and it's usually the guys too. I don't know if this happens to you guys. It's usually guys. I'm like, guys, we need some sunscreen. And they say, no, I don't. I'm Black. Yes, you do. Because skin is skin, and you can still get affected. Sunscreen is needed to prevent the sunburns, and of course, that increased risk of skin cancer that we see all the time. All right, so that's the biggest things we're talking about tonight. Thank you so much for joining on. I always enjoy speaking and teaching you guys about just what's going on in your bodies. I love to make it simple, concrete, so that you can understand it, so that you can know what's going on, what you need to do, and really how to enhance the quality of your life. All right. So for more great information like this, don't forget to follow me on any of the social media platforms, including Twitter, Facebook, Instagram, Pinterest at Dr. Sabine Elisee. That's Dr. DrSabine Elisee, Dr. Sabine Elisee. And just don't miss out on all the great things happening and what we're learning. So you guys have a great night. Enjoy the rest of your week. The sun is out. It is the summer, so sun is out. So that means sunglasses on to avoid that pterygium. Sun is out. Go ahead and put on that sunscreen screen, at least SPF of 15 or greater. And the keywords that we're looking for when you're picking up that label, of course, is broad spectrum UVA, UVB protection as well too. All right, I want to say hi to everyone that's joined us tonight. I want to say hi to Jessica Ramos. Good seeing you. Thanks for joining us. Destiny Daniels, always great. Nisa Jones, always love seeing you guys. I also too want to say hi to, let's lean in here, JPP_10. Glad you could join us. And then there's Bomb AE22. And then we also have, I'm trying to read upside down, guys. Cami Love 1, good seeing you. Melly Mystique, hi. See Nixie. And we also have Transforme_IT pageant. I want to wave to you guys as well too. Good seeing you. Thank you so much for joining us. And again, if there's something that you want us to talk about a little bit more, something that you're a little bit more curious about, don't forget to go ahead and send me that information to any of those social media platforms like I mentioned before. You guys have a good night. Take care and put on those sunglasses. Bye.